Thank you very much, and really pleased to be able to join you tonight. Sorry not to be able to be there in person, but we've got lots of people online as well as hopefully lots in the room. And what an important and timely discussion as well, given the announcements that we had from the Health Secretary this morning. And pleased to be adding to some really excellent and moving contributions that we've had so far. When I look back on what's happened to our NHS in the last 14 years, I don't know whether to be outraged or despairing because we've got waiting lists 3 times what they were in 2010. None of the major operational targets for cancer are being met. Thousands of people in my constituency are having to wait 4 weeks for a GP appointment. And as for NHS dentists, well, we know right around the country that NHS dentistry has been run right into the ground. And I have what's been called the Sahara of dental deserts in my constituency in Waveney Valley in East Anglia. And indeed, the decline in health services in East Anglia was the top issue that residents raised with me during the general election campaign and have done since. And it's a top priority for me to push for the funding that's needed, but also for the protection of the principles of the NHS, and dentistry as part of that is a key priority for me as an MP. So to give you a feel for where the Green Party is coming from, which the chair's already outlined, one of the most worrying declines is in public trust in the NHS. People trust the healthcare workers, brilliant workers such as Holly, who we heard from tonight. But in 2010, 7 in 10 people said they were satisfied or very satisfied with the health service, and it's now below 1 in 4. And that's because of just how severely overstretched it is with the huge impacts that has on staff as well as on patients. And it's a reflection of how people feel because our NHS has been deliberately run down. And as Nye Bevin famously said, the NHS will last as long as there are folk left with the faith to fight for it. People will fight for something which they believe in because it delivers for them and their families. Let me tell you about one of my constituents who came to see me in August. His young son needed treatment to reduce a future cancer risk. The NHS waiting time for surgery was 62 weeks. The NHS surgeon said that he could perform the surgery much faster if my constituent paid privately. And of course, my constituent wanted his son to be treated by the NHS, but he couldn't afford to take the risk of waiting. And that particular constituent, I think, is able to find the means to pay privately, but not everyone can do that. And how is any parent supposed to keep faith with the NHS when it's not there for their child, or anyone that's not there when it's not there for their relative? So it's absolutely vital that we restore trust in a publicly run, publicly funded NHS, which has been run down for too long. Now, Lord Darcy reminded us in his recent report that 14 years of cost cutting has shortchanged the NHS by 37 billion in capital spending alone. Crumbling hospitals, lack of medical equipment, an outdated IT system. It's no wonder that people's confidence has been undermined. And of course, we see a significant rundown, as the previous speakers have talked about, in the day-to-day spending in the staff that make the NHS what it is. Now, the Secretary of State's talked about reform and he's been bullish about it, but he hasn't been specific about what he means regarding private sector involvement, and we need to challenge on that. We also need to clarify and challenge, I would say, some of what we heard in the Health Secretary's announcements today, because in talking about league tables for hospitals, well, league tables haven't worked in education, have they? And I think pitting one hospital against another, when they'll have a different range of challenges, a different set of patients from different demographics, I don't think that's the way to address the problems in the NHS compared to engaging with staff and professionals on what's needed. So as well as challenging the way the government's going, let's also put forward the reasons why we need to keep the NHS public and the real reasons why privatisation is a huge concern. One is that it's wasteful to have constant bidding and tendering for services, and that's just not only my opinion, it was the finding of a previous Health Select Committee report back in 2010, although sadly didn't stop the Cameron government, the coalition, introducing the Health and Social Care Act in 2012. And that exposed the NHS to private markets and made it almost mandatory to outsource some NHS services, something that Lord Darcy said has had an impact that's been a calamity without international precedent. Secondly, the NHS benefits from cooperation instead of fragmentation. Thirdly, publicly delivered services don't waste money on profit. And fourth, staff have safer terms and conditions under the NHS. And as we've already heard, staff retention is a huge issue. I've seen with my own eyes just how stretched staff are in hospital, in our hospitals and throughout the NHS. So we know the impact of privatisation of the NHS. It just doesn't work, and it's not what people want either. 87%, according to a recent YouGov poll earlier this year, want to keep the NHS in public hands. So that's what we need to fight for. We need to fight for the funding that's needed. We need to fight for the restoration of services, and we need to make sure that that applies to all aspects of the NHS, including dentistry, including pharmacies, which are being undermined by having flawed contracts just in the way dentists do. And as Lord Darcy said in his report, nothing that I have found draws into question the principles of a health service that's taxpayer funded, free at the point of use, and based on need, not ability to pay. I believe we can and must turn around the NHS, and we must do it by keeping it in public hands and making sure it's properly resourced. Thank you.